Hi everybody. Hi, I came today to update. I actually realized this morning that it has been 1 year to the date since I had my bilateral mastectomy. I had it September 17th, 2013, my bilateral mastectomies, and today is that day. So I decided to make a video. I know I just did a blog with the updating of everything that I've been going through, and I'll probably just say some of the same stuff that I said in that. I'll probably just probably say it again in this video because I did not upload a video to YouTube with any updates. So in the blog, I had mentioned that I am, of course, still having treatment done. In May, I was told that I have metastatic breast cancer, that it is in my lungs. So started in June with new chemotherapy regimens. I was on eribulin, and then I was on capecitabine, and which is capecitabine and Xeloda. They're the same thing. They're a pill. And then I was on ixabepilone together with the pills. And after that, I had some scans done because I developed a pleural effusion, which was pretty bad because the first time that they did notice that I had 500 cc's of fluid, and then literally 5 days later, I had 1,000 cc's of fluid. I had to get tapped again, and that's when the thoracic surgeon came in and said, you know what, this isn't good, you being tapped so much, because we could collapse your lungs and that wouldn't be good. So I immediately had surgery like 2 days later and had a Aspira Pleurodex catheter placed in a tube that went into the pleural space so that I could drain the fluid myself at home. Well, in the process of getting that tube, I was able to, for at least, I believe it was, let's see, I got it put in on July the 2nd, and the last time I drained from it was July 23rd. And up until that point, I was draining roughly anywhere from between 300 to 400 cc's of fluid a day. So it did its job up until that point, and the pleural space shrunk, thank God, it closed. And then I waited a month after and had the tube removed, thank God. But all during that time, I had also been switched on my chemo drugs, and I'm now on capecitabine and no, carboplatin, I'm sorry, carboplatin and gemcitabine. That's the regimen I'm on right now. I actually went for chemo last week, Thursday, and I'm going again this week, Thursday, for chemo. So that will be another round completed. I already completed a round of these meds. So this will be a second round of these meds, and then we're going to do a third round in October on the 2nd, I believe is the date. And then I'll be having scans to see, where it's going, what we're doing, and how we're going to move forward at that point. Right now, feelings wise, as far as like side effects from this, it's not too bad. I mean, I get tightness in my chest, and that could be from the chemo, or it could just be from the nodules in my lungs. I still do cough a little bit, but not nearly as much as I did before, because I am now on steroids, my little puffy face. I'm on steroids, which brings a whole another set of issues with it, but you deal with it. The steroids have raised my blood sugar, so I'm on diabetes medication. I'm taking metformin, and the metformin serves two purposes. right now. Metformin, there was a study done where patients who were diabetic, cancer patients who were diabetic and that were on metformin, tend to do, their cancer medications tend to work better. And they don't know why, and they haven't discovered why, but it seems as if patients who are on metformin, the cancer medication works better. So it's a plus for me that I'm on the metformin because now it is also being used as a cancer drug. So it's keeping my blood sugar pretty stable. It's not to the point where they're like, oh my gosh, you need insulin, because it's not that high. And I don't have diabetes, so to speak, because my A1C, which is an average of what your blood sugars have been, it's normal. This is just due to the steroids, which is a side effect of the steroids, along with, some indigestion. And then the metformin kind of makes your stomach not do too well sometimes, but I manage to deal with it. And of course, I do get tired because chemo can make you very exhausted. And then the steroids can keep you up at night. It's like, what do you do? So I go to sleep for a little bit, and then wake up. Then I'm up, and then I do stuff, and then I'm back, going to sleep again. So let's just say I manage. I get tremendous help from my family. My mom, my aunt, my husband, my cousins. They help me so much, and I wouldn't be able to do it without that support team, because they help me keep my house up. They help me with my daughter. They help me with everything, okay? Everything. I would not be able to do it myself at all. And for anyone out there that's battling cancer, I don't care what kind of cancer it is, you do need a great support team, because excuse me, because that is the way that you get your rest, the way that you're able to maintain, and of course my faith. I have a very strong belief and faith in God, and I know that God is there for me, that God is, it's his plan, and he is making it work, and I am 100% following his orders. Done deal. And I have peace. I have peace with my situation, and I am grateful for it. I thank God every day for every day that he gives me, and for everything that I am able to do, and thanking him. There is nothing like peace, you guys. Absolutely nothing. Life is short, and that goes for everybody. I don't care if you have a disease or not. Life is short. Cherish the people that are in your life. Cherish the time that you have here on this earth. Forget about petty things. It doesn't matter. It's not that serious. Love the people who love you. Even love the people who don't love you. Actually, that's the best thing, is to love those that don't love you, because they need love. And maybe your love would change them. You never know. But anyway, now I'm rambling, and I don't want to do that. But again, it's been a year since I had my surgery, and I can honestly say I'm okay. I'm okay. And thank you guys for watching and listening, and I love you. Thanks for your support. Thanks for your love, your prayers. Thanks for your kind words. Until I talk to you again, be blessed. Peace.